Hi, welcome to HIM5106 Module 9. We will talk about the technical informatics architecture for population health. These are our learning objectives for this module. Readings and viewings include the textbook, Chapter 29, National Public Health Informatics for the U.S., and the Gartner Report, Market Guide for Healthcare Provider Population Health Management Solutions, the 2018 update. Population health, people, process, and technology are needed. Population health refers broadly to the distribution of health outcomes within a population, the health determinants that influence distribution, and the policies and interventions that affect those determinants. It's holistic in that it seeks to reveal patterns and connections within and among multiple systems and to develop approaches that respond to the needs of populations. Population health tactics include rigorous analysis of outcomes. Understanding population-based patterns of outcomes distribution is critical to addressing population needs in communities. For example, patterns inform the selection of effective population health management strategies to diminish problems and develop approaches to prevent reoccurrence in the future. In order to do this, we need to understand how people work, how they live, how they play, understand not only the human factor, but also the workflows and the processes, and utilize data and technology. Informatics for population health. Populations can be defined by geography or grouped according to some other common element. For example, you could have a population of employees, population by ethnicity, or by medical condition, or some other type of criteria. A person can be, and most likely is, a member of many different populations. And population health informatics must look at multiple determinants of health outcomes, including medical care, public health interventions, and the social environment, as well as the physical environment and individual behaviors and patterns among where we live, work, and play, as well as chronic disease management. And this is an example of the chronic care model, which includes community resources and policies, health systems, informed active patients, and prepared proactive practice teams. These are the 4 pillars of population health: chronic care management, quality and safety, health policy, and public health. I would say that population health is much more than chronic care management, and that is one area moving forward that has an opportunity for us. And this is another model for population health. Again, you see some commonalities here, not just the healthcare system, but also public health and looking at prevention and health behaviors. So how is population health different from disease management from an informatics perspective? The use of data warehouses and registries, typically from health systems, to facilitate the collection and analysis of data regarding health outcomes. Data storage serves as the basis for efforts to improve those outcomes over time using mathematical or predictive models to risk stratify the population and identify patients with the greatest future vulnerabilities. For example, those people that have declining health status or have increased healthcare utilization. Using technology support tools, incentives, and tailored communications, engaging at-risk patients and their healthcare providers in a collaborative approach can help to foster high-value self-care behaviors. These are components of the population health paradigm. Health promotion, which includes prevention and wellness, screening, health management of behavior change, patient self-care, patient-centered or patient-driven medical homes, chronic care management and disease management, case management, eliminating health disparities, cultural competency in order to be able to understand our different populations, and of course, data and health information and technology. So this has been the technical architecture for a very long time. Having transactional systems that have patient data as well as administrative data within healthcare systems, then having that data flow to a data warehouse, which is typically heavily protected. It's managed by a information technology team. It's a huge amount of data. There are a lot of processes around this data. It's tightly controlled. It can be very difficult for health policy researchers or population health experts to be able to get at this data. The data is really there for the primary use of clinical care for the patients and administrative use, to bill the patient, to bill their payer. New technologies are now simplifying this architecture. So think Amazon Web Services. It's subscription-based. There's architecture in the cloud, services in the cloud, and they include every type of analytics platform to be able to look at data from a descriptive perspective all the way through to predictive, using tools such as Amazon SageMaker, which uses artificial intelligence and deep learning. Analytics for population health. We start with basic reporting and retrospective reporting, which looks at what already happened. Then we move into foundational analytics, what is happening, then predictive and prescriptive, what will happen and how can we stop it if it's something not good, and then cognitive analytics, what is the optimal treatment or intervention. New predictive capabilities with artificial intelligence and machine learning allow for predictive, prescriptive, and cognitive analytics. So move over basic reporting so we can be actionable rather than reactive. These two figures come from a recent paper from the National Academy of Sciences, Vision for a Systems Architecture to Integrate and Transform Population Health. So you can see here from figure 1 on the left side, society, organizations, operations, and agents. And then if you look at all the different types of domains, many of which produce data over in figure 2 on the right side, we have all types of attributes, not just health data from an electronic medical record, but also economic, demographic, organizational, public concerns, scientific, business, programmatic, policy, security, natural and built environments, community, faith. And we also have data feeds. Some are already out there and they're public. Some are generated through individual people. And then we also have many different types of modeling and taking a look at different criteria in order to stratify and look at different populations with the goal in mind that we don't want to just reiterate the data that we already know that has already happened in the past, but to be able to wrangle all of our data, including historical data, and mash it up with other types of data to be able to keep people healthy, prevent bad things from happening, prevent disease, and provide ways to be able to keep people out of the health system where it's more cost effective and patients and people in the community have a higher quality of life. So the assignments due for Module 9, one is to make sure that you read that Gartner report and then provide a 10-minute summary. The second activity, in that Gartner report, Gartner analysts mentioned the line between enterprise analytics solutions and population health solutions has now blurred, and this can create a confusing market for buyers and introduces the potential for unnecessary duplication in analytic and integration tools and capabilities. Research what has changed over the past couple of years in terms of people, process, and technology within the healthcare information and technology departments, within healthcare systems, payers, health information exchanges, different systems, roles, and policies, and develop an executive briefing that is 1 to 2 pages in length. Also, the Group Population Health Project or Program Proposal, Deliverable 1, which is the draft, is due by 8 a.m. Eastern Time on June 7th, so timely feedback can be turned around to you before June 11th.